Colon cancer is the third most common cancer diagnosed in people in the US, according to the CDC. The American Cancer Society has estimated that about 1 in 23 men and 1 in 25 women will develop colorectal cancer during their lifetime. It is also a serious health concern affecting millions worldwide. Colon cancer is a type of cancer that starts in your colon, also known as the large intestine or the rectum. It's important to be aware of these 9 early warning signs, as early detection can significantly improve outcomes. Let's dive in. Number 1. Palpable mass. A palpable mass in the abdomen or rectum can be an early warning sign of colon cancer. Colon cancer typically begins as a small growth or polyp in the lining of the colon or rectum. Over time, these abnormal cells can proliferate and form a tumor. As the tumor grows larger, it may become palpable, meaning that it can be felt by pressing on the abdomen or rectum during a physical examination. With colon cancer, a palpable mass may be located in the lower abdomen, particularly if the tumor arises in the sigmoid colon or rectum. In some cases, the mass may be felt during a digital rectal examination if the tumor is located close to the rectum. If you notice a lump or swelling in the abdominal or rectal area, it's important that you bring it to the attention of your healthcare provider. Number 2. Rectal bleeding. Rectal bleeding can have various causes, and while it might be due to less severe conditions like hemorrhoids, it can also be an early indicator of colorectal issues, including colon cancer. Rectal bleeding typically presents as bright red blood passed with or without stool. The blood may be streaked on the surface of stool, mixed with stool, or seen separately on toilet paper after wiping. In some cases, rectal bleeding may present as darker, tarry stools, which can indicate bleeding higher up in the digestive tract. Bright red blood in the stool typically indicates that there is bleeding in the rectum or colon, which may be a sign of colon or rectal cancer. Typically, patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens and is more likely to be accompanied by pain. If you notice blood in your stool or on the toilet paper, it's crucial not to dismiss it. Number 3. Persistent nausea or vomiting. Persistent nausea or vomiting, particularly when coupled with other digestive symptoms, should be taken seriously. These symptoms could be indicative of issues within the gastrointestinal tract, including the possibility of colon cancer. Nausea and vomiting can occur if a colon or rectal tumor is obstructing the bowel and inhibiting the passage of liquid or solid waste or gas. Bowel blockage can also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting may occur at any stage of colon cancer, but are more common with advanced disease. In rare instances, untreated or advanced colon cancer can lead to complications such as perforation or rupture of the colon. This can occur if the tumor erodes through the wall of the colon, allowing stool and bacteria to enter the abdominal cavity. Perforation of the colon is a medical emergency and can cause symptoms such as severe abdominal pain, fever, and nausea or vomiting. Number 4. Changes in bowel frequency. Any significant and persistent change in bowel frequency is another important sign that should not be overlooked. Whether you're experiencing increased or decreased bowel movements, it's vital that you pay attention to these variations. An abrupt shift in bowel frequency could be a signal of an underlying issue, including colon cancer. Colon cancer can affect the normal transit time of stool through the colon. For instance, if a tumor obstructs the colon partially, it can slow down the passage of stool, leading to constipation and a decrease in bowel frequency. On the other hand, if the tumor causes irritation or inflammation in the colon, it can accelerate transit time, resulting in diarrhea and an increase in bowel frequency. Most people have a regular pattern of bowel movements that they consider normal. Any significant deviation from this pattern, whether it's an increase or decrease in bowel frequency, may be a cause for concern. Number 5. Fatigue. Chronic fatigue or weakness that persists despite adequate rest and sleep can be a symptom associated with colon cancer. Cancer-related fatigue can be debilitating and impact daily activities. Extreme tiredness is a non-specific symptom, but happens to be very common in people with more advanced cancers, such as stage 4 colon cancer. Cancer fatigue differs from ordinary fatigue in that it's not usually relieved by rest or counteracted by a good cup of coffee. It's not uncommon for a person to have a sense that something is amiss in their body, even if they don't have specific symptoms to back up that feeling. Trust your intuition. If you are concerned that something is wrong, make an appointment to talk with your healthcare provider. If you're getting value, let me know in the comments. Number 6. Tenesmus. This term refers to a persistent feeling of the need to have a bowel movement, even when the rectum is empty. It often accompanies conditions affecting the lower gastrointestinal tract, including potential issues like inflammatory bowel disease or, in more severe cases, colon cancer. Colon cancer can develop in any part of the colon or rectum, and tumors located in the rectum may cause irritation or obstruction that leads to tenesmus. When the colon or rectum becomes partially obstructed, it can trigger a persistent sensation of needing to evacuate the bowels, even if the rectum is empty. Colon cancer can cause inflammation and irritation in the lining of the colon or rectum, leading to increased sensitivity and discomfort. This inflammation can contribute to symptoms such as tenesmus, where the body interprets the presence of the tumor or irritation as a need to evacuate the bowels. This persistent sensation can indicate an underlying concern that requires proper evaluation and attention. Number 7. Changes in stool color. Your stool's color can be a valuable indicator of your digestive health. Stool typically ranges in color from light to dark brown, depending on factors such as diet, hydration, and the presence of bile pigments. While diet and medications can influence stool color, persistent and unexplained changes may signal underlying issues, including colon cancer. Bleeding in the colon due to colon cancer may result in bright red or dark red blood in the stools. More specifically, if bleeding is in the ascending or right side colon, the stools may be more maroon or purple in color since the bleeding is occurring farther away from the rectum. If the tumor is in the descending or left side colon, the bleeding tends to result in bright red stools, indicating the passage of fresh, red blood, also called hematochezia. Blood in the stool is always a reason to see a healthcare provider, since it may be one of the first symptoms of colon cancer. Number 8. Narrow stools. Thin or narrow stools, often described as ribbon or pencil-like, can also be a sign of colon cancer. This change in stool size is significant because it might suggest a partial obstruction, possibly caused by the growth of a tumor. Colon cancer typically develops from precancerous polyps or abnormal growths within the colon. As the tumor grows larger, it can narrow the lumen of the colon, restricting the passage of stool. This can result in stools that are thinner than usual. Initially, the change in stool shape may be subtle, but it may become more noticeable and persistent as the tumor progresses. Narrow stools are often accompanied by other symptoms of colon cancer, such as changes in bowel habits, rectal bleeding, or abdominal pain. Number 9. Personal or family history. Individuals with a personal or family history of colon cancer or related conditions are at an increased risk. While not symptoms in themselves, they are significant risk factors that require close attention and proactive screening measures. Certain genetic factors can increase the risk of developing colon cancer. Specific hereditary conditions, such as familial adenomatous polyposis or FAP and Lynch syndrome, which is the most common form of hereditary colorectal cancer, significantly elevate the risk of colon cancer. Individuals who have previously had adenomatous polyps or precancerous growths identified during colonoscopy are at increased risk of developing colon cancer. Moreover, having a personal history of inflammatory bowel disease can also elevate the risk of colon cancer. If you have a family history of colorectal issues or have previously been diagnosed with polyps, it's crucial to inform your healthcare provider, as this information helps in determining the appropriate screening measures and monitoring for any potential signs of colon cancer. Recognizing these 9 early warning signs of colon cancer is crucial for timely diagnosis and effective treatment. If you or a loved one experience any of these symptoms, it's essential to seek medical attention promptly. Remember, early detection greatly improves the chances of successful treatment and recovery. Also, it's important to prioritize regular checkups and screenings. If you found this video helpful, Don't forget to give it a thumbs up, share it with your friends and family, and hit that subscribe button for more health and wellness content. Stay healthy, stay informed, and until next time, take care of yourself.